So they feel that relief. It can happen, but again, I would say that don't expect it must happen. If it doesn't happen, doesn't mean that therapy is going bad. Sometimes, again, it varies from person to person, problem to problem.
I'm a little scared, and I want to know that what can I expect from my first therapy session if I come to you now?
So a lot of time what happens is because in therapy, the client gets an environment where they can speak very freely without any much filters and very freely express, and they sometimes get very vulnerable. They feel like crying, they cry, and that comes like a huge relief to them. Like even in first session, they feel like their burden, like they just put down their burden and relief. They feel relief after like maybe few months or sometimes many years. So sometimes that happens within the first session, although that I'm not saying that the problem is solved. It's just a relief after a long time since you are carrying the burden of the problem that you're facing. So they feel that relief. It can happen, but again, I would say that don't expect it must happen. If it doesn't happen, doesn't mean that therapy is going bad. Sometimes, again, it varies from person to person, problem to problem. So again, in the first session, as a client, they can expect to feel some of this relief. It can be huge relief also for some client, but some relief everyone feels. Second part is they get a space where they can talk about anything and everything, again, in a very non-judgment free, and like they don't need to be afraid of any kind of consequences. So that they can expect. Another thing, what happens in the first session is more of a orientation into the whole process. They get to, like, whatever questions they have about therapy, they get to ask those questions and clarify if they want to, and also understand what process they are getting into. So they also get clarity about it. But again, another important factor of therapy is insight, that you get insight into why you are facing this problem. That sometimes you get some insights from the first session itself. Sometimes you get insights about the problem later on into the process.
Okay. So, there's this one question that I've always had personally, that what is that special thing that happens inside a therapy room that can genuinely help a person heal their issues? Like, are these the questions that you as a therapist ask your clients, which forces them to find their answers and to get the insights, as you mentioned? Or like, what are the helpful tools of therapy, and how do they help someone to actually heal themselves? Like, what is that special thing? Because I can talk to a friend, like that's what people say. You can talk to us also. Why do you need to go to a therapist? So what is different about therapy that will help me to actually gain those insights and move ahead?
I think that's a beautiful question, a very important. Second, I think while answering this question, I'm like sharing the insider secrets. Like,
Ooh.
so basically,
Okay.
Again, I'll answer it in 3 different parts. So, and some of these things might get a little too technical. So again, like, so you might need to, like, even the audience might need to have some patience. If something doesn't make sense, they can ask in the comments and we can address those later. So years of research showed that what helps in therapy or what improves the patients is the therapeutic relationship, the relationship that they share with the therapist. Obviously, it's a professional relationship. It's not friendship. It's not any other relationship. It's a professional but a therapeutic relationship, which has 3 components to it. One is empathy. Second is genuine interest. Third is unconditional positive regard. And these 3, I'll explain these 3 in detail a little in a while. But these 3 actually are found to be the most important parts of therapy. Let me explain. So when I say genuine interest, so when you share with a family member or a friend, they are already maybe preoccupied with their certain things. कि मुझे ये करना है, जल्दी से बोलो. Yeah, they might feel, because if you are sharing something very really sad, it will evoke sadness in them, and they might get uncomfortable with their own sadness and might not be willing to listen. So a number of things can be there, but therapist is there genuinely concerned about what problem you are facing, and the whole focus is on you, what you're feeling, what you're thinking, and how to address those problems. It's not about the therapist ke fatafat say what solution can I give, what advice should I give, which happens in the cases of friends and family. So that genuine interest is there, which, like, for example, if a session is of 1 hour, one person, a professional, is sitting there absolutely focused on you for that 1 hour, and hence it's not just another conversation. Second is empathy, which is the root tool the therapist uses to solve the emotional pain, which is to understand that, okay, this person is feeling this way, and being with the person in that feeling and helping them realize that together over time we can contain these painful feelings and we can work through it. So a person is with you in those feelings. Again, it's not that if you're feeling sad, a friend would come and he will listen to you or maybe give some advice ki ye kar le, or let's go party. So that none of those is empathy. Therapist ka main tool is empathy. They will sit with you, help you first to understand what you're feeling, what can we do about it, how to cope with those feelings, how to contain them, and then move forward with some solutions and insight, which solutions comes much later. First step of healing is empathy, to know that there is someone who is understanding what is going on inside me, even at times when I am not understanding what's happening inside. Someone who has studied this, understood it, and he or she can help me to look into it and see what I am feeling and how to cope with it. And third part, which is absolutely magical, is unconditional positive regard. Sounds a little technical, but in very simple terms, even our parents give us conditional positive regard, or you can say conditional love. कि तुम इतने marks लाओगे, then you are good, otherwise you are bad. हमारी बात मानोगे, then you are good, otherwise you are bad. But in therapy, whatever you have, whatever you are, everything is regarded as positive. No matter how deep, dark, painful it might be, in every moment the therapist is there with you. There is no judgment, there is nothing to be ashamed of. And this third one, unconditional positive regard, when it is given over time in the therapy sessions, it actually like changes things. Because root of the mental health problems are rooted in our early childhood experiences, in how we experienced our parents, our important people when we were growing up. And most of the problems like depression, anxiety, and even relationship issues, how we feel as an adult, are coming from the roots. Again, how we experienced it. It's like एक प्लांट के रूट्स में बचपन में जब वो सीड था तब उसे क्या मिला था, वहाँ से वो आगे प्रॉब्लम्स आती है. एंड इन थेरेपी वी एज थेरेपिस्ट प्रोवाइड देम अ हेल्दी अटैचमेंट with the therapist, which again this knowledge is not available to the like common public, that this is what happens in therapy. And this at times is a very subconscious process. Even client doesn't realize it, even sometimes therapist doesn't realize it, but the work is happening because you are getting, you can call it again, when I use the word love, not the romantic love, but unconditional love in therapy. No matter how painful you are feeling, there might be certain things that you are too ashamed of. In every step you are given positive regard. You are not looked down upon. You are always considered that you are important. And that's one of the very important factors of what heals people in the long run. And obviously there are certain tools and techniques which comes under cognitive behavioral therapy. Those are also absolutely important. There are certain techniques of working on your thoughts, working on your feelings, which are also taught like outside, which a person can practice outside of therapy. But again, First, I talked about the deep work, and this is also a symptomatic relief work.